Well, this Saturday marks the 3-year anniversary of the day everything changed.
March 11th, 2020 was the day the World Health Organization declared COVID-19 a pandemic.
That same day, the NBA suspended its season when a player on the Utah Jazz tested positive. It was the beginning of a new normal for all of us. UW Health Chief Quality Officer Dr. Jeff Pothof has been with us every step of the way for the past 3 years. He joins us now via Zoom as you are recovering from COVID. Doctor, thanks for being with us today.
Yeah, I had a good run there, but it finally caught up with me, guys.
So were you really sick or not?
You know, not too bad. I had worked in the emergency department last Wednesday, and it was a busy shift. I had stayed late to tie up some loose ends on my patients, and I was just really tired when I got home, and I didn't think too much of that. But then later that night, I developed a slight cough and tested, and I've done it so many times before with a slight symptom, and this time I was positive. So I've been isolating in the lower level of our home for the last week. But the good news is today is day 6. My rapid antigen is negative, and I'll wear a mask out in public for the next few days until I get to day 10. But all in all, my symptoms were fairly mild.
Well, that's good to hear.
Such a reminder that it's still with us. We're not out of the woods yet. You know, it's incredible to think it's been 3 years. 3 years ago, we knew nothing. And now we've learned so much about the pandemic. But are we still sort of building the airplane while we're flying it? We're still learning things all the time, aren't we?
You know, I think we are. I feel a little bit more confident in the airplane that it's staying in the sky. But, you know, early on, we just didn't know anything. How sick were people going to get? How protective was our PPE going to be? How would we even treat this disease? Was it going to be like other disease that we, you know, were familiar with? At that point, we had no vaccines, no therapeutics, no nothing. And we really wanted to slow the spread so that we didn't have, you know, even more people than what passed away meet their fate with COVID-19.
Yeah. How can we use all of that information going into the future?
You know, I think the best thing to do is to take, you know, all the ups and alls, the downs of the last 3 years, and then make sure we chronicle that so that whoever gets to fight the next pandemic, and I sure hope it's not me, has that information, can preemptively kind of understand some of the things that will go well during the pandemic and things that won't go well. And hopefully whoever does this next time can be more successful in, you know, eliminating severe disease or decreasing the amount of deaths than we were.
Do you think we're better prepared for another one?
Yeah, I think we understand what we need to do better, but whether or not we'd be able to actually do the things that we need to do to, you know, preserve life or save life, I'm not so sure. I think, you know, going into it, I was under the impression that, you know, as we came together as medical professionals, scientists, and the data changed, you know, folks would be receptive to that. And I think in a way it's sort of backfired. A lot of parts of our life, when people tell a different story, they tend to lose credibility. Those of us in science, we do that all the time until we feel more and more and more certain of what's actually truth. But that can create problems as far as creating followership and having folks listen and you know, do what we think they need to do to keep both themselves and their family safe.
Absolutely. Well, we're glad that you are feeling better.
Yeah, hang in there.
Join the ranks. Doctor, thanks for being with us today.
Thanks, Dr. Pothof. Great to see you.
Thank you.